Back to Health Coach Radio. I'm Erin Power, and today I want to talk about something that should make every health coach sit up a little straighter. Bryan Johnson, the tech entrepreneur spending millions to reverse his biological age, has publicly stated that of everything he's done, all the diagnostics, all the supplements, all the blood transfusions, the hyperbaric chambers, the full-time medical team, the single most impactful intervention, behavior change. Not a molecule, not a miracle, behavior. So let's unpack why that matters, especially for you. Bryan Johnson has access to everything. Continuous biometric monitoring, full metabolic panels whenever he wants them, precision supplementation, AI-driven protocol optimization, not to mention time and money. And yet, the biggest needle mover was things like sleep discipline, meal timing, exercise adherence, alcohol elimination, and consistency. In other words, the boring fundamentals. And this isn't really shocking to anyone trained in health behavior science, but it's culturally shocking because we live in a medical industrial environment that over-indexes on intervention and underestimates adherence. So let's zoom out. In medicine is extremely good at diagnosing, prescribing, recommending, advising, and extraordinarily bad at sustained behavior adoption, motivational alignment, identity shifts, environmental restructuring, habit formation. The limiting agent in modern healthcare is not knowledge, it's execution. We've heard this a million times. There's information everywhere. Information is not the bottleneck, it's integration. And integration is simply behavioral. So here's where I want you to lean in. A health coach is not support staff or the accountability buddy or the cheerleader. We are applied behavior change specialists. If behavior change is the intervention, we are the experts. And according to tech bro, biohacker, longevity guru Bryan Johnson, who has millions of dollars and all the time in the world to devote to every possible health intervention you can think of, behavior change is the one that made the biggest difference. I heard this on a podcast. That's why this came to mind. He was asked on a podcast what his number one recommendation is, and he said behavior change, and that's us. We are trained in motivational interviewing, understanding why these changes are important to the client in the first place. Self-determination theory, a self-determined person who's oriented toward intrinsically motivated goals will execute more consistently. We're trained on the stages of change. We're trained on identity-based behavior formation, values alignment, autonomy support. So when a millionaire biohacker says behavior was the biggest lever, he's unintentionally validating our entire profession. Okay, because technology scales data, so technology scales information, but coaching scales integration, implementation, execution, adherence. That's what we do. Let's get clinical about this. Behavior change impacts circadian alignment, hormone signaling, inflammatory load, mitochondrial efficiency, body mass preservation, lean body mass preservation, your cardiovascular fitness, your sleep architecture. And here's the key. Those variables actually compound. Those variables compound. Supplements can tweak, like a device can optimize, a procedure can kind of like intervene. Do you know what I mean? Like leaning on those tactics and jumping over the basics of behavior change doesn't get us meaningful results. So behaviors compound. Small, repeated daily actions reshape physiology at scale. A good example of this, strength training. If you lift weights, you know it is one of the most impactful things you can do. It's also slow. We don't get real strong real fast. We don't build a lot of lean body mass quickly. I'm in the fat loss space, and I always joke with my fat loss clients that you think fat loss is slow, you should try building muscle. It's even slower, right? It's not a hack. It's not a tweak. It is a behavior that compounds over time. And you don't need a $2 million budget to produce the effect. But here's the tension of it all. Behavior change is hard, slow, unflashy, non-viral. It's not patentable. You can't like trademark, go to bed at 9:30 or walk daily. You can't monetize, drink a little less alcohol. I mean, so the market just doesn't glamorize it, but our biology rewards it. If you're a health coach listening to this, I recommend you stop positioning yourself as helping people eat better, optimize your nutrition, supporting healthier habits, encouraging lifestyle change. These sound bites say nothing and they minimize your skill set. What you are doing is facilitating neurobehavioral wiring, my friends. You're interrupting reward loops. You're strengthening prefrontal regulation. You're reshaping default behaviors. You're building autonomous motivation. This is foundational work. This is your moment because the longevity industry is exploding and potentially imploding, quite frankly. We have GLP-1s, we have peptides, wearables, CGMs, epigenetic clocks. And yet every single one of those tools still requires human behavior change. The future is not either or. It's both and, tech and behavior. A good example, GLP-1s. Let's just go there. Because I'm in the weight loss space, my clients are exploring them. Because my clients are exploring them, I've explored them. I've tested them out on my own body to see what they feel like. And what became immediately clear to me is these don't work unless you change your behaviors. Yeah, you still have to change the way you eat, the way you move, the way you live. Does the medicine help? It can help. It can help to facilitate those behaviors, but you still have to do those behaviors in order for it to all work sustainably. We want sustainable outcomes here, right? Coaches sit at the behavioral layer of this. And if we don't claim that layer, well, someone else might try to automate it. But the good news is adherence is not easily automated. Intrinsic motivation is not easily outsourced. Identity change is not like programmable. This is all very human. I've said this for years, even before AI hit the scene, before technology really became overwhelming. A health coach is a human working with another human. The human to human connection, the work between humans will never, we hope, go out of style. Not anytime soon anyway. You know? We can get a little doomsday about what happens when AI technology takes over. It can get a little weird if you think about it, frankly. My hunch, just a hunch, is that it might force us to return to the humanness of it all, you know? If every job is outsourced and we're getting a universal paycheck and we're kind of living in communes again, just amongst each other, the human-to-human connection might even become, we might return to it. But in the meantime, here we are, health coaches, humans, having meaningful human conversation with other humans. I had this question in my advanced health coaching class that I teach. I teach an advanced health coaching certification course. And one of the students asked me, hey, Erin, how do you track all of your clients' like biometric data, the stuff you're getting off of their Oura Ring or their MyFitnessPal? What kind of tool do you use to track that? Is there like a client management system that you use? Are you using a Google Sheet? How do you keep track of these things? And I said, I don't look at any of that. I literally have conversations with my clients. Conversations. What feels like the most important thing for us to tackle this week? Why is that the most important thing for you? How does this shore up to the bigger picture health goal you have for yourself? What's going on in your life that could present a barrier to this goal this week? We are tiptoeing up the world's most minuscule staircase, step by step by step by step to the top of the staircase by executing simple behavior change minutia that we can track by having conversations. Hey, Sally, how did that go last week? Did we succeed or not? No? Let's readjust the goal and try again this week. Or should we set a new goal for this week? What feels best to you? What feels most important to you? Like a human having a lived experience is a dynamic, complex organism. And we just can't really just apply technology and data to that. That's my perspective. But hello, this is my sandbox. Here's my invitation. Level up your behavior change literacy. Study self-determination theory. Study behavioral economics. Identity-based habit formation. This is all the stuff that we teach in our advanced health coaching course. Become so competent in behavior architecture that physicians, functional practitioners, longevity clinics, metabolic health clinics, and clients see you as utterly indispensable. You're the expert at behavior change, the most impactful of all the health tech out there. You're the expert in, you're the certified, bona fide expert in behavior change. Bryan Johnson just proved something. The most expensive experiment in longevity confirmed what coaching science has known for decades. Behavior is the master lever. If you're in this profession, don't shrink your role. You're not the add-on. You're not the afterthought. You are the multiplier. And the more technically advanced healthcare becomes, the more valuable true behavior change expertise will be. So until next time, stay curious, stay evidence-informed, and keep elevating our profession.